Hello, I'm Okada. I'm a vitreoretinal specialist from the Royal Victorian Eye and Ear Hospital in Melbourne, Australia. Today I'll be discussing the issues of treatment adherence to intravitreal therapy. Now, we can all appreciate that the introduction of anti-VEGF therapy really has revolutionised treatment for our patients with neovascular AMD. However, in the real world, the evidence and the daily clinical practice often do not match those results that are seen in the pivotal clinical trials. And this is potentially due to issues such as lack of adherence or persistence with the recommended treatment regimens. So one issue that we found when we started doing a systematic literature review looking at the issues of treatment adherence was that there were significant variations in both the terminology and the definitions used to describe the situation. And so studies really weren't comparing like to like. So we set out to develop and validate a set of definitions for terms related to adherence and persistence specific to patients with neovascular AMD. We started by forming a subcommittee of experts from the AMD Barometer Leadership Coalition to really drive this consensus development. So these are members of a global committee who are all experts in retina and healthy aging. We developed a modified Delphi approach to really look at crafting and validating this set of definitions. This was a multi-step process with both internal and external validation and endorsement from the wider Vision Academy group of experts, who again are also international experts in retinal diseases. We started by defining the term adherence, which is broken down into full adherence, adherence, and non-adherence. We decided on the term adherence, a more modern terminology which does not assign blame or causality compared to historical words such as compliance. So full adherence is the ideal situation where no visits are missed, and adherence is where one visit is missed over a 12-month period, which is a more realistic representation of adherence. Non-adherence, conversely, equates to 2 or more missed visits over a 1-year period. We also specify in our definitions that adherence is to be calculated annually, really to capture for the change in behaviour and circumstances for a patient over time. The next term that we defined was persistence, which is often incorrectly used in the literature or used interchangeably with the word adherence, but in fact really represent 2 different scenarios. Adherence can be thought of as looking at how well does a patient follow the recommended therapy, and persistence reflects whether they continue treatment. Here, the consensus process defined persistence as maintaining therapy or monitoring, and the patient attended the most recent appointment within the last 6 months. Conversely, non-persistence is where a patient has not attended any appointments or has no appointments scheduled over a period of 6 months. So it's important to realise that a patient can be both non-adherent yet still persistent to therapy. Finally, a separate terminology, discontinuation of treatment, was also used really to separate out those patients who stopped treatment at the instruction of their treating physician due to issues such as treatment futility. Finally, we also set out a classification system for the reasons why patients may be non-adherent or non-persistent to therapy. And these follow the WHO domains for adherence, but were really more specific to AMD. So these are broken down into several categories. Firstly, there could be patient-related factors. For example, a patient may have systemic comorbidities such as dementia or ill health. Number 2, condition-related factors. So this can be, for example, a patient has poor baseline starting vision. The third factor can be therapy-related issues. So, for example, a patient may have treatment discomfort from the intravitreal injection and fears to have further injections. Number 4, socioeconomic factors. And this is a very important category because, for example, patients may have difficulties in accessing transport to attend their appointments or have lack a caregiver to bring them to their appointment. Number 5, health system related factors. So, for example, difficulties with appointment availability. And finally, other factors. And one prominent factor here is uncontrollable or unforeseeable events. And we've all seen how the COVID pandemic recently has disrupted therapy for a significant number of our patients. So to summarize, we know that lack of adherence to and persistence with anti-VEGF therapy really are significant barriers to optimizing the outcomes for our patients with neovascular AMD. The goal of these validated definitions is to ensure that there are uniform parameters and that accurate data can be collected in future trials on treatment adherence and persistence. The goal is to try and provide an opportunity to better understand some of the reasons and the impact of non-adherence and non-persistence. And ultimately, we need to try and help and identify these at-risk patients and develop more targeted solutions for these challenges.